The treatment for hygroma is generally grouped into two big categories. Over here we have a non-surgical therapy, everything that is not surgery. Over here we have surgical therapy. And in this group, the dogs that have surgical care for their hygroma, they often get the medical therapy as well, okay? So if your dog's hygroma is very small or not bothering the dog very much, then you may be over here in the non-surgical therapy. So the best ways to treat a small hygroma is to get that elbow padded up with bandages and get that dog barred from laying down on hard surfaces. We all know at this point that hygromas form in response to repeated pressure trauma of a bony prominence on a hard surface, okay? So when a dog lays down on a hard surface repeatedly with its elbow or its hip, then it's more likely to develop a hygroma, which is a fluid-filled pocket under the skin. Feels very squishy and very round usually. So in order to get that dog to get better or heal from the hygroma, it cannot lay down on hard surfaces anymore. So you need to provide multiple comfortable resting spaces for that dog around your home that are not hard and keep the dog away from the hard surfaces. A orthopedic mattress, such as the big Barker beds, which are like this thick, excellent option for these dogs because it cushions the joint away from hard surfaces. Okay, they also will teach you how to wrap this hygroma in padded, thick bandages, because just keeping it padded, if it's not a big hygroma, the body can often heal itself, right? That's the best case scenario. If you are in that category, your veterinarian also may recommend to use some photobiomodulation. Very fancy word, means cold laser therapy, and that is non-invasive, not painful. Most dogs love it. It's where they take a cold laser and they laser in the area that is affected to reduce inflammation and speed healing. Another awesome therapy for hygromas. If your dog has a big hygroma or a hygroma that has broken open or a hygroma that is infected, then your dog may be in the surgical candidate. Again, you're going to need to talk to your veterinarian and have them take a look at your dog to see what's the best case, what's the best treatment for that dog. But for the big hygromas, the painful hygromas, the infected hygromas, the open and weeping hygromas, those guys respond best to surgical therapy. So there you have it. Non-surgical, surgical therapy. Talk to your local vet to see what is right for your dog.